I thank you again for joining us on this latest
The
media
Ontario
briefing
Medical
on important
Association,
healthcare
in an
issues in
attempt
the
to
news
fight the
today.
amount of
So
misinformation
with
being
that,
spread
thank
regarding
you,
COVID
Doctors Greg
19,
Evans
held a
and Lauren
media
Rosek.
briefing
We're now going
recently.
to open up the
Doctors from
Q&A
across the
session.
province participated
There's a
and weighed
lot
in
of
with their
outreach going
concerns
on because there's
regarding
hundreds of new
vaccinations
cases, and
and
each
the
of those
threat
cases is going to
of
generate
COVID
new
19
cases. Next
variants.
slide. The testing that we do to find variants is actually a bit complex. It's time consuming. It requires resources. There was some investment in it at a research level, but that's really been now amplified. And particularly here in the province of Ontario, I know my colleagues who work at the Public Health Laboratory in Ontario, as well as hospital labs, including my own, have now really ramped up our ability to do genomic sequencing to look for and find these variants so we can understand where they are, how they've proliferated. And as Dr. Wright was commenting on, we need to develop our strategies about what does that mean if a particular variant with some problematic expression sort of pops up. So we're getting there. It would have been nice to have been there a little bit earlier. I think everybody knows the original B.1.1.7 variant that arose in the southeast part of England actually was first detected back in the fall. So we're a bit behind, but I think things are improving very quickly with the help of my colleagues who work in laboratories to try and find the variants.
Dr. Samantha Hill, the president of the OMA, says that those that get vaccinated need to share their experience with others.
Whether or not you get your vaccine is going to make a difference. Whether or not you talk to people about having gotten your vaccine, you tell them about how easy it was, or if you had some side effects, what they were, and how you're still happy that you got the vaccine, because whatever that side effect was, swelling arm, itchy, feeling like crap for a day or two, it's still better than having COVID and having potentially infected your family or having wound up in the hospital in the ICU. So again, just a congratulations to Mark for raising that question and realizing that the power to get past this pandemic really does lie with the Ontarians.
Dr. Fahad Razak closed the briefing by saying that the rise in COVID 19 variants remains a threat to the healthcare system.
Yeah, so I think the biggest worry for practitioners in the hospital sector, which has really went right up to the brink during the second wave, when you look at the data that was being presented by the government by Adelstein Brown, the majority of hospitals in Ontario were just a few beds away from reaching capacity in their ICUs. And as someone who's on the ward side, we were constantly shuffling patients back and forth to try and enhance ward capacity. The new variants could tip us over. So that's the greatest worry that I have. And I think important from a messaging perspective is that the very same things that we've been telling people for the last many months are as effective against the new variant, but they have to be adhered to. So the importance of physical distancing, the importance of using a mask, the importance of limiting interactions except for essential purposes, those steps become even more important now with the possibility of the variant overwhelming our system. So I think many of us have looked in horror at collapses in the New York health system or in Italy. We're not that far away from something like that happening here, and it can be the difference between a few weeks of uncontrolled spread of the new variant. That could be as little as it takes to push us over the brink. And so I think the importance of holding on, even in this time of fatigue, I think everyone is tired, but holding on for the last stretch to get people vaccinated, for the warm weather to arrive, for all those things to happen, for virus transmission to go down.
More COVID 19 information can be found on the Ontario Medical Association website. In Niagara, you're watching The Source.